Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin Hung. The world of technology and healthcare are ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be reacting to the CMS request for input, the RFI on technology to improve Medicare. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 19 years of health IT content at healthcareittoday.com. Colin, did you know you'd be a government, like a government policy nerd, that would be in your future?
I honestly did not, but it's actually, I gotta say once you dive in, it's okay. Like the water's fine. It's actually kind of interesting.
Yeah, I actually didn't have any clue about it, and then meaningful use came right with $36 billion of stimulus for EHR, and then we all kind of had to become that, in because there was so much money and it was so fast moving. You learn all these things like the RFI process, the interim rule, the final rule, like all this stuff that you're like, wow, I never knew this even happened, and now we've all been somewhat educated on it.
Yeah, and I mean, then hey, listen. At this moment in time, with all of the changes that are happening, it's really interesting to kind of dive into policy and direction. And I'm not sure how much we can infer from the overall direction, from this one document that's come out, but it's certainly fun to kind of dive in and see what they said. So we'll put a link to the document that we're referring to, the RFI, in the description. But John, right off the top here, what do you think about CMS asking for input on technology for Medicare beneficiaries?
Yeah, so I mean, it's funny. We let off with policy wonk stuff, right? And it's interesting. I hadn't seen a lot of RFIs, and maybe that's because we usually see the interim rules and final rules and not as many RFIs. But I'd say that my first reaction is it's pretty cool that CMS, together with ASTP, ONC, whatever we call it these days, that they came together and said, hey, let's just not assume we know what the industry wants. Let's actually ask them. So I thought that was actually a pretty smart move, because I could see a lot of other administrations, just coming in and just going at it with their own kind of personal perspectives and ideas. And certainly they've heard from, the industry, but the fact that they said, hey, there's a lot going on here, and we're kind of at an interesting inflection point. This is my own take, that we've had some policies. We've all adopted EHRs for the most part. We largely have that implemented. There's data now in electronic format. We've done some efforts around, TEFCA and secure data sharing. There's been some standards there. We've had EHR certification going for a while now. And it is kind of this point where it's like, okay, we've had all of these. What are the lessons learned from the past 15 years or so of policy and health IT policy that we should then kind of, what's the path going forward? So to me, that's what this RFI is like, hey, we've done all these things. What worked? What didn't? What do we need to get rid of? What do we need to add? And they're asking the industry to help them understand how they should approach it, rather than just going in and starting to cut and put their own things in place. So on that note, I think it's actually a really cool effort.
Yeah, I mean, I wasn't a policy wonk when meaningful use was being considered way back then. I only became one after it was released, and I had to sift through that giant document. But I wonder if I don't know if they did something similar, but to your point, this is pretty cool. Like the fact that they are not asking for commentary, because that's one thing. And they have done that many, many times, to ask for commentary on something they've already put out. This is
Yeah.
before anything's put out, you know. So I think that's pretty cool. The fact that they're kind of going, as you said, to market, to ask for six stakeholders, opinions, to answer some key questions. You can kind of infer where they're going, but in general, I think, to your point, John, it's encouraging that they're asking people, okay, what do we do now that we have all this electronic data, right? Like, what are some of the challenges? What are some of the things we can do with it? So yeah, I'm encouraged that this document exists. even if nothing comes of it, I just think it's nice that, an agency with this much power and influence is asking for a fairly wide spectrum of perspectives on what to do and gathering it from anybody.
Yeah, well, and I think it's safe to say that something will come of this. The only question is, what will they listen to and which parts will they listen to? Because it is a lengthy questionnaire, basically, of a wide variety of stakeholders. And so, like, the length alone, they can't address it all, one. And two, how are they going to pick and choose? And are they still, is it going to be kind of like the consulting company that you bring in to tell everyone what that what you want to do is the right thing to do? Like we see that happening with consulting companies and leaders all the time, where they're like, hey, this is what I want to do, can you give me a report that says that? I don't think that's quite where they are. Like I think they are sincerely interested in hearing great ideas that they can implement to streamline things, to improve things. And what's interesting about this document, it comes from a perspective of technology can and will improve the Medicare beneficiary experience, and we should be using it. Like it doesn't even presuppose that we'd go backwards, right? Like there's some way to go backwards when it comes to technology. That's only like, hey, how can we leverage technology to improve it is the question, not should we. So, there are some areas where it's like, should we be exchanging or different things, but for the most part, it really is a pro technology perspective, which I think we all agree with.
Yeah, I mean, in the way they phrase the questions, it is sort of tech and time agnostic, which I found interesting because it's not tied to, hey, like, what if we used AI, right? Like it just talks about technology in general, and it talks about that, it's not tied to a specific point in time. Kind of like when I look back at some of the meaningful use stuff that came out, that was very fixed to the technologies at the time in terms of some of the requirements and things that came out. We look back now and go, why the heck did we put that in there, right?
Mm-hmm.
Time, as you put it, times change and evolve. So the one thing I did infer from this RFI that I liked was the fact that they tried to be agnostic, and that, like, how they asked the questions and what they were looking for wasn't sort of saying, hey, give me a tool name, right, that we can use, or a methodology. Let's talk about some things at a higher level than that.
Yeah, in fact, they
Um,
kicked back against the suggesting specific tools. It's like, hey, this is more about the general ideas and policies and things that are there. But I agree. Like, even when they said, if they were to say, like, is Tefka working? They also said, is it not working? Right? Like, so they
right.
asked both sides on almost every question.
Yeah, no, and that brings up the next point I wanted to ask you, John. Like in the document in the R5, they asked six key stakeholders in their mind, and I'll just list them very quickly. So the stakeholders they are looking for commentary from or input from is patients and caregivers. That's one. Providers, two. Three, payers. Four, technology vendors, data providers, and networks. And the last group is value-based care organizations. So sorry, there were five. I miscounted.
Yeah.
um, so are those the right stakeholders, John? And do you think they will get these stakeholders involved?
Yeah, well, and they broke out the questions into, I think, four, patients, technology, providers, et cetera. But even within that, they said, hey, we want to hear from everyone, right? Like, so even if these patient questions and you're a provider, you can talk about how it's impacting your patients. That's great too, right? So I actually think they were super inclusive and really want to hear from the full spectrum of stakeholders within the healthcare industry. It's interesting. I didn't see pharma on the list, which I think is fascinating. I mean, they're kind of a technology provider, maybe if they have some digital health solutions, therapeutics, whatever. But like it was also interesting, and I think this was done very much deliberately. They put patients first, right? And said, hey, we want to hear from patients. And they said, patients, please reply, patient advocates, we want to hear your experience. So, kudos to them, that we've been talking about this for so long at conferences. We need to listen to the patient, and they put it front and center, I think purposefully, to communicate that, hey, this is about the patients and what they're experiencing. So yeah, I didn't see anyone that they didn't include, so I thought it was very inclusive.
Yeah, I think the one that struck me that I really liked seeing was they called out caregivers, right? I mean,
Mm,
to your point, we do see we've heard a lot about patients. Caregivers is much more recent. So to me, that's a sign they were really listening, and they really are maybe a bit more in tune with the market than we give them credit for, right? Because the caregiver experience is becoming such a hot button issue where that is perhaps even bigger burden than what is the patient, right? Especially if we're talking about patients who are unable to care for themselves. So I like the fact that they included caregivers, which to me kind of talks about their inclusivity. Wasn't as clear. They in a couple of spots they had it, but I mean, they didn't really call out clinicians. I mean, it's under the umbrella provider, but as we know, provider is a very broad term, right? I mean, it could be the
Mhm.
administration people, So I didn't see clinicians called out in here. That was one kind of, I'm sure they meant to, or it's kind of implied under provider, but that was one. And the one that you also mentioned, no mention of pharma in here or any of that part of the ecosystem, which I guess is fine. They're not really involved in this side, and they can get involved as a vendor, as you said. They probably fall into that category for a lot of the therapeutics that they offer. But that was one of the big ones. I do like the fact they did include payers, right? That they didn't exclude them.
Mhm.
So I like the fact that they were there as well. So you know, are we going to get a lot of involvement? I think so. Especially as news of this sort of spreads, I think every one of these stakeholders will get involved. I'm not 100% sure about is the value-based care organizations. Are they
Mhm.
really going to chime on volume? I think the other ones definitely, but I'm not really sure about that one category of stakeholder.
Yeah, I mean, some of them will, right? Farzad and his crew are going to definitely be chiming in on that. I can't wait for their write-ups where they summarize their thoughts. But yeah, one that I think is interesting too is the EHR vendor. Of course, they
Mm,
fall under the digital health provider category and technology provider category. But what's interesting is when you read a lot of the questions are kind of coming after the EHR vendor. And if I'm the HR vendor reading this, I'm probably reading it and thinking, man, I better open up. I better make sure my APIs are working and that I'm sharing data the way I should. A lot of the questions are kind of saying, hey, where are EHR vendors not doing what they should? And because we want to make sure that they are, right? I think that, maybe they didn't need to identify EHR vendors because they know they're all going to reply, and the EHR Association is certainly going to reply and talk about things. But so they're going to be part of the process for sure. But it is interesting how they're kind of pitting the digital health companies, if you will, the innovators as they probably consider them, against the EHR vendors who obviously have the data store to enable many of the digital health solutions. So that'll be an interesting dynamic to see play out. I'm sure we'll get lots of replies and comments from them. But it is kind of a little bit of access to that data that they're going after, and I think that we'll see that one play out for sure.
Yeah, it's funny. You mentioned the EHR companies. I actually interpreted it a little bit differently. I thought maybe they were kind of out to, out to single out the HIEs, the
Mm,
networks, because a lot of the questions to me were asking questions around value. Like, what is
yeah.
the value of an HIE? What is the value? I mean, that's the way I interpreted some of those questions. I don't think they were out to like, hey, these shouldn't exist. I think really they were just asking questions of where's the value in that part of the ecosystem? How can we maybe do it better, differently, and so forth. So I read some of the questions as, oh, like maybe they're really looking at that HIE model and going, what more could be done? What needs to be tweaked on that front? And was to me a little bit less about the EHRs, but
Mm.
that's the one I took when I read some of the questions was really more hey, maybe the HIE is where they need to do more in terms of providing value back to their own networks.
It is true. They were questioning the value of the HIEs and not necessarily questioning that they have value, like you said, but like, hey, let's figure out where this is and let's scale it up, right? To be
Right.
even more valuable than it is.
Exactly. Exactly. Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we are discussing the CMS request for input on technology to improve Medicare. It's our policy day today, is essentially, this is the policy episode.
Policy nerds.
So John, when you read the RFI, what are the topic areas from in that CMS, ASDP, ONC, wherever thing we're going to call it. What stood out for you in terms of the topic areas that were covered in the RFI?
Yeah, there's a bunch that I could hit, but and I'll steal a few from our friend Brendan Keeler as well. But you know, I think he's, he kind of mentioned that they're kind of wielding information blocking, and he said, beware if you're an information blocker, which of course, people that are information blocking obviously often don't think that they are. Kind of like an addict doesn't realize they're an addict, until it's too late. But anyway, I think they are saying, how should we be leveraging information blocking more effectively? When I read the questions, I wasn't quite as strong as Brendan, I think, as far as that. But I do think they're saying, hey, this is the tool that we have available to us, and we want to use it effectively because we don't want information blocking to happen. So I think we'll see more of that. The other one that I think that's super interesting for me, and maybe it's because I'm such an old policy nerd, but EHR certification is definitely being questioned in this in this RFI, that they're looking at and saying, what is the future of EHR certification and what should that look like? Which makes sense because that is one of the main duties, big, at least large duties of ASTP ONC, right? To say, hey, how do and it's one of the tools in their toolbox that they can wield to actually affect change. So I think we're going to see a massive change of EHR certification. That's my prediction coming out of this. Is they're focusing on it. So, and I actually think that will be a good thing because it will unveil some innovation that wasn't there. I'll throw a third one, then let you have a few as well. But to me, what this says, the questions that are asked is that TEFCA isn't dead. Now, how much power and support's going to be behind TEFCA will probably depend on the comments they receive. So if they get a lot of comments saying, yeah, let's keep going with TEFCA, it was a nice alternative to some of the other national networks, or it solved some problems for us. And interestingly, it didn't really talk about public health with TEFCA. I thought it would. And that was a huge focus of Mickey, obviously, is bringing in all of that. And maybe that's a separate discussion. But anyway, I think TEFCA isn't dead, and it probably will, how alive it is will depend on the comments. That's what I see.
Oh, those are all great. Actually, I didn't pick up on a lot of that stuff, so that's really good. That's really
Mhm.
informative for me, John. For me, one of the topic areas that really jumped out of the page for me was just how many questions there were around APIs, like
Yeah.
and how to encourage more use of them. How can we make them better? How do we make them easier? I mean, there was obviously a lot of comments and questions around the standards, but they were all relating back to APIs,
Yeah.
right? And so, and to your point before, a if you're an information blocker, watch out because clearly they have you in their targets. And B, if you don't have APIs, better get moving on that because there was a lot of focus in this RFI around the use of APIs, how to encourage more vendors to use them and provide them. And although it wasn't asked, you could see the implied question of, oh, and it should be free, right? Like, there shouldn't be a cost barrier to use them. So I found that interesting as a key kind of topic area that kind of spanned across all of those different stakeholders. I also thought there was a couple of questions that um, I wasn't sure how to interpret, so that's why it stood out to me. But they were talking and asking questions about what the role of CMS is, or ASTPONC, in reviewing or promoting apps and programs.
Ooh,
Now, you
that
could
was
interpret that as you said, like in terms of EHR. I actually read that a little bit more as to what about apps and things going forward?
mm,
Um, should ASTP get involved in reviewing and promoting and looking at AI tools and to your point, like public health tools and those kinds, like how broad is that going to be needed? Especially with the AI boom, where now you literally have companies just popping up, and there is no guarantee that what they produce is medically valid. It's kind of left up to the individuals to kind of buyer beware. Can ASTP help with that? Not sure, right? Certainly don't think we should go back to what the certification program was, but I don't think they want to either. But do they have a role? I think is they're asking that question. I thought that was kind of interesting in terms of a topic area. Um, and then the one interesting one for me was a question actually they didn't ask, and a topic area they didn't cover. Talked a lot about consolidating the medical record, but I know in recent years we've been starting to hear of actually that's not what everyone wants. Like except the patient. I mean, they want their consolidated record, of course, right? But if you ask most providers and payers, they want access to the relevant parts of the record that are relevant to them. They don't want the whole thing, right? So what I found, again, we've heard this over and over again to say just exchanging the entire record is too much. Actually, I don't want all that stuff. I just need a part of it. So how do I do that in this format without getting the whole thing? Because I don't want to be responsible for the whole thing. So I found that that was kind of an interesting. I found it in a couple of questions. I didn't see that kind of filtered as much as I thought it would, but anyway, those were the interesting topic areas for me.
Yeah, I agree on when it comes to the full patient record. And I think what we've come to the realization is that we'll never have a full patient record. So why are we even trying for that? Right. Like that's a little bit my view, but I think a lot of people like that are realistic say it's too disparate, right? We're never going to have everything. So let's not try to have everything. Let's try to have what's useful, which is kind of what you argued as well. Hey, let's find stuff that actually does make a difference and like make that happen. So I think that's interesting. And you're right about the digital health apps. There were kind of two forms of it too, right? Which is, should we be almost kind of be FDA of digital health? They didn't say that, right? But like it was kind of like, is that what we should be doing? Is kind of this FDA kind of approval of digital health apps? But also, what digital health apps should we be using for Medicare beneficiaries, which of course CMS has a big interest in, and then that obviously goes into accountability care as well, and some of those efforts. But yeah, so I think that's going to be really fascinating to play out. A couple others that were interesting to me is I think they kind of say they're not sure about fire and bulk fire. So there was a little bit of trepidation. I don't know, like understanding, hey, where is this really working? We've been working on this a long time. Is this the best way? Is bulk fire the best way? It felt like there was a sense of that. I don't know if that was intended or not, but anyway, it will be interesting to see how the fire community comes after that, and where that, if they say, hey, we're not, hands off, we're
Yeah.
we're in, or if that's how they respond or not, right? They also gave a little small nod to price transparency, like, hey, we know this wasn't that effective. Is there something we could do that would be effective? I thought that was an interesting one that will definitely be fun to watch play out. And then the other one, this one was fascinating to me, was this kind of identification, national provider directory kind of stuff that we've talked about in a lot of years. It was interesting that they even mentioned Clear, ID Me, login.gov as these identity ones. And it definitely felt like a really pro digital identity approach, since they're saying, should we use this? Why aren't we using this more? Like it kind of felt like that, way, which it's amazing to have an organization like Clear and ID Me mentioned in this RFI. But yeah, anyway, that one will be interesting to see play out, and I will not be surprised if we finally do get a national patient identifier, or at least some action there that we'd never seen before. Maybe not necessarily from this, but even from some other stuff too.
Yeah, I think the days of that legislation are numbered because in the modern world, I mean, you could find out everything about anybody anyway. Like the fact that a national patient ID does or doesn't exist will not affect that greatly either way. So yeah, it's interesting that we're now starting to see like Clear and all these other things kind of pop up, and we'll be tracking that over the next little while. We only got a couple minutes left, John. So for this last question, just a quick hit from you. What do you think are some of the things that Medicare could do with the technology to improve things for patients?
Yeah, I actually am really pro streamlining the EHR certification, sunsetting the things that are essentially accomplished. I lean pro TEFCA on pushing it forward. I think there's some, it needs some more, push behind it, and we'll see how it evolves. Like, I don't think it's the death of the other national networks. I think they serve different purposes. I think there's some value there, and I'd love to see it, pushed along. So I think that that's something that's interesting. The information blocking, if it can be wielded to be able to enable the APIs that you talked about, and that if we come out of this with all the digital health companies, including EHR vendors, providing these APIs that allow for seamless access to the information to be able to create some really cool innovations, I think that will be an amazing outcome. You know what's missing from this though? Is any sort of dollars and cents. And maybe CMS and ONC don't have those dollars and cents. That has to come from Congress and legislation. But that's where actually it would really impact it. Like if we started incentivizing sharing of data, we incentivize security, which by the way, I don't think security was included in there at all. If we had some incentives there, we'd see even more action.
Yeah, I think, I mean, there's a lot of, I mean, where do you go with this question, right? Like there's so many
It's
things
only
that
how
they
many
could do.
$1 trillion of the budget.
Yeah. Yeah. I mean, you're absolutely right in terms of this will really depend on how much money they have to spend and frankly, the amount of power and jurisdiction that they either want to seek or are given, right? Either way. So I think that a lot of depends on that. I do think that they can do some interesting things with where we are now as opposed to where we were years ago. I think it would be very interesting. We have heard about the breach wall of shame and all those things, but maybe on the positive side, it would be interesting to see Medicare or ASTP to kind of almost like the old BB bulletin board days, right? Like who's contributing the most data and who's taking the most
Ooh.
data, right?
So a
Like,
positive
like
twist on the wall of shame.
exactly. Like it's sort of the positive side, like, hey, this company, their API is contributing the most to interoperability. Like the most
Ah.
data flows through this API or this set of APIs from these kinds of companies. You almost rank them, right? To say these are the companies that are most open,
Ooh.
and vice versa. Who are the people consuming the most data that's being put out there? Like who's retrieving all this stuff? And it'd be interesting to see on that side, who's consuming all this stuff. So that's kind of interesting because they're in one position to kind of look across all of the HIEs, all of these organizations to kind of get a sense of that. That would be certainly very enlightening, I think, as to what's going on in the ecosystem.
That's fascinating. Tefka kind of did that a little bit. Number of points, number of things. Of course, the data was small, but yeah, I like the positive. I mean, Colin, you're a positive guy. I should have expected this.
There you go. That's a little of the Canadian that's coming out, right? Hey, well, thanks to all of you who tuned into this episode of Healthcare IT Today. You can find out more details about our show by checking out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hung, along with my friend and Health IT collaborator, John Lynn. Thanks for listening and have a great week.